One of the things that I have focused on is patients with acute myeloid leukemia who are older, above the age of 60, have relatively poor prognosis. We have previously published that they have high rates of health services utilization and hospitalization, and we were really interested to see what were the reasons for these hospitalizations and why were patients spending a significant proportion of their life from diagnosis until death in the hospital. And we were interested in the concept of a potentially avoidable hospitalization, which is a hot topic now because as we are thinking about both medical costs and also what patients want in terms of the time they spent at home versus the hospital, we would like to optimize the time that patients spend away from the clinical setting. And so in this study, we looked at 329 patients from Mass General Hospital and the Dana-Farber that accounted for about over 1,000 hospitalizations, and we coded these hospitalizations using a novel criteria to think about what are potentially avoidable hospitalizations. In the study, we found about 17% of patients had potentially avoidable hospitalizations. These are older patients with acute myeloid leukemia. Now, interestingly, half of these hospitalizations were coded as the patient had a premature discharge from prior hospitalization. And when you look at that number, that 50% of 17%, it tells you that that is the criteria we utilized to talk about premature hospital discharge was very, very objective. So it's being discharged and having a readmission within 7 days with the same problem that you came in for. And that tells you that there may be something there that we can potentially intervene upon and do something upon.